Welcome to another edition of Health Matters. Because your health matters, we are committed to bringing you quality programming under a variety of topics to bring you information, and that information is only powerful when you act on it. Hi everyone, I am Anna Marie Sinatra from Sinatra Solutions, and I am very excited, and I'm reminding you again to make sure that you have your pens and papers with you, because I have a program for you that is going to blow your mind, literally. You'll see what I'm talking about, because I am at the DENT Neurologic Institute on Sheridan Drive, just off of the 290, very easy to get to, filled with some amazing doctors who are going to bring you some amazing information. But before we get started, let's hear a word from our sponsors.
DENT Neurologic Institute is proud to support Health Matters. DENT Neurologic Institute offers neurologic education, state-of-the-art diagnostics, and cutting-edge clinical research. If you or someone you know is looking for more information, visit our website at dentinstitute.com.
I'm Kathleen Maxian with the Western New York Ovarian Cancer Project, and we're a proud sponsor of Health Matters. Our mission is to educate the Western New York community on the symptoms and risks of ovarian cancer. We also have supportive programs for women who have ovarian cancer, including professionally facilitated support groups, our Cancer Answers workshop, and our signature Comfort and Hope Tote program. Continue to watch Health Matters, and we'll continue to educate you on ovarian cancer.
Electronic Merchant Systems is proud and honored to bring you such creative educational television as Your Health Matters. We believe in we educate and you decide.
Welcome to the DENT Headache Center.
Oh, thank you so much, Maria. It's so wonderful to be here. I'm so excited. We have such a beautiful show lined up. But before you take us back to see the doctor, you gave me a little story about what we're standing in front of, which is just so heartwarming.
Yes.
Tell everybody about that.
Well, back in 2007, about 20 of us went to Tanzania, Africa, and we climbed Kilimanjaro, specifically to raise funds for our brain tumor patients.
Wow, wow. Well, if you ever plan a trip again, let us and the viewers know. We might want to come with you.
You can be our camera crew.
Oh,
and our
I like
host.
that. I like that. We might not be able to climb all the way to the top of the mountain with you, but we'll get you as you're going up.
Perfect. You got a deal.
Follow us back. We'll go get the doctor now.
Great.
I feel so honored and privileged to be sitting next to Dr. Laszlo Mechtler, who has been on TV, not only locally, nationally, but all over the world.
Yeah, recently we've been thrown in the limelight of international and national media on some interesting cases that we've treated here at the Institute. So it has been curious over the last year to be on Good Morning America or Dr. Drew or Fox TV,
Wow.
and even international media such as BBC and the German and several Japanese TV stations actually flew in to tape a few interviews with us. So it has been a kind of an interesting last year and a half.
So do I ask, do you speak Japanese, or do they bring you a translator?
Domo arigato gozaimasu, konnichiwa, ichiban. I leave it at that.
Okay, I'm not going to ask. But if you know what he said, you could email me and let me know. That's pretty cool. So you are doing amazing work here. We're so excited to be here to educate the community. I've done my homework. Looking at your website is so informational. But you have a list of credentials that I don't even know if I could even read them all. So why don't we start by you giving us a little bit of background?
Well, I'm actually from Australia, but I moved to Western New York as a teenager. So I actually went to high school here, then left and came back. So my education part is from Texas, where I did my neuro-oncology, in Buffalo at the DENT Institute and the University of Buffalo. So I've been honored to practice and educate myself in part in Europe, in part in the United States, and that includes Texas, by the way. And in part Australia and Canada. So I've been around, but I've been in Western New York since 1989, so I've been here for quite a long time.
And you were telling me earlier that you started off at Roswell Park.
Yes, after I finished my education and my fellowship in neuro-oncology in MD Anderson in Houston, Texas, I came back in 1989 to take a position at Roswell Park and at the DENT Neurologic Institute. And I've been in both facilities ever since, being the chief of neuro-oncology at Roswell Park, and at the DENT Institute I've gone through different positions, and now I'm the medical director and the director of the Headache Center here at this institute.
Which I'm understanding, as I've been doing my homework, that we're not just going to say people just have migraines or headaches. There's a whole variety of things that could be going on with them. And you're going to help us to understand that for those who are watching who might think they just have an occasional headache that you're having every day, or it's causing you some other physical discomforts. In the meantime, you're going to help them to understand what might be going on so that they can get some good help.
Well, yes, as a physician, what do? We cure people, but often we can't cure people. We treat people. We minimize suffering. Now, where can you minimize suffering in diseases more than you can in headaches? The World Health Organization has made a statement that one of the most disabling chronic disorders in the world is headache, specifically migraine. So it's the duty of all physicians to treat pain, and in our headache center we focus on relieving pain and improving quality of life, which for many people can dramatically change their lives. And we've put a team together here that is able to help not only the community in Western New York, but even beyond that.
Yeah, especially now, too, as you know, once our program airs on local TV, that we're uploading to YouTube and sharing it all over social media so that we can reach you to get you this very cutting-edge, important information to have a healthier lifestyle. When I was reading the notes that you sent over, the statistics on how many people, wasn't it like 75% of the people suffer from headaches in one way or another? And
well, if I can quote some statistics,
please.
There's 32 million people in this country suffering from migraines, of which 3/4 are women. Most common age is between 20 and 45. I think one statistic that may be important is that 52% of patients do not know they have migraines. And migraines, by definition, is a disabling headache. We're not talking about a stress headache or a tension headache. We're talking about a disabling headache. And let me just quote you one more number.
Yes.
There is about, this disorder, let's call it migraines, affects the whole population and causes about $15 billion worth of lost income for the industry. So that's called medical economics.
Right,
How much does it cost?
Right.
Well, because some people can't work because of the headache, and some people go to work and can't function. We use the term absenteeism and presenteeism to describe that. So it is a really disabling disorder. And we always kind of laugh, it doesn't kill you. Well, let me tell you, there's something called suicidal headaches.
Really?
Yeah, we call those cluster headaches. A little bit different than migraines. But the migraine phenomena is being recognized more and more often. Why? In part because we have drugs that work. In the past, we really didn't have great drugs. Now we do have drugs that specifically will treat a headache and improve quality of life and put individuals back to work, back to their family. It's very important to understand that we do not have to accept pain. We do not have to accept suffering. How often do you hear the story, well, my mother, my grandmother suffered from headaches, so I suffer from headaches. That's a fallacy. You do not have to suffer from pain. And that's why we have a system to allow patients to treat their headaches in part by lifestyle changes and in part by medication. But the first part of it is what you're doing, education.
Exactly. Education. And one of the things I want to pick up on, too, is you said everything so perfectly, is the importance for you to get this information and then get proactive on it. So there's a few things that I want you to touch on, what people could look at in your own everyday lifestyle. And then you talked about drugs, like how they'll know the difference when it's time to possibly look at a regimen or a system that might be helpful. And also when you talked about biofeedback as well can be helpful. So I know I'm throwing a lot at you at once, but I'm so excited to get this information out.
Yeah, the treatment of a headache, and let me emphasize one point.
Yes.
A migraine is not just the headache. A migraine is a constellation of symptoms, which includes a headache, but it includes light sensitivity, noise sensitivity, nauseousness, with disability. So most people don't understand. It may not just be a headache. It may be other symptoms. So we treat the whole complex of symptoms in the migraine. And patients have to be proactive and have to realize, first of all, there is hope. Where there's hope, there's treatment. But they have to take the first steps. And as I mentioned, I used the statistics. Over half of patients don't know they have migraines. So educate yourself, find out what migraines are about, listen to this, what we're talking about today, go on the internet, educate yourself so you can come in and be prepared to treat your headaches and maybe be the first step in your life for better quality of care.
Absolutely, absolutely. You know, the days are gone thinking that you could just take a pill or just depend on your doctor to fix everything for you. We have to be proactive with the information, with our lifestyle. So for those who are watching at home today, how would they even begin to know? Like as I'm sitting listening, I'm thinking, I get a headache every now and then. You know, you may be thinking, I have headaches or I have headaches every day. What would be the distinguishing differences that would have them say, I better go check this out a little further?
Disability.
Ah.
If you have a pain that on a scale 1 to 10, 10 being the worst, over 7 or 8, that's by definition a disabling pain. If you have disabling pain in your head that reoccurs every so often, then you, by definition, most likely, statistically speaking, have migraines.
What's every so often?
It could be once every week, once every month.
Really?
Or it could be 3 times a week. The frequency is very individualized.
Wow.
And the longer you wait, the more frequent your headaches will become.
Wow.
So that's why if you have children, bring your children in. Because if you don't diagnose at the proper time, the headaches will increase in frequency, and then you have a child who will fail school, will have a failed marriage, will be fired from work, will not have any health insurance because they can't work, and they can't treat their headaches.
Wow.
So it's a vicious circle, and we need to stop that cycle of pain as early as possible. And that's why we've set up a pediatric headache center under the directorship of Dr. McVige.
Yes, I think we're going to talk to that person in just a little bit.
She's much lovelier than I am, I promise you that.
Well, I'm so excited about continuing getting this information. I know also when I was reading the notes that you sent over, you talked about smoking and you talked about caffeine usage and different things. Like, is there things that people can do at home before they come to you to see if they can get a difference in what's going on?
Yeah. 80% of what we do is a holistic approach, looking at lifestyle. Remember, we have legal drugs in this country that affect headaches. The legal drugs I'm talking about are caffeine, nicotine, alcohol. They have to be addressed. If you're a smoker, if you drink too much coffee or tea or diet soft drinks that contain caffeine, then you need to compromise and decrease by a significant amount. If you don't exercise, you start exercising. Now, if your lifestyle is that you watch movies to 3 o'clock in the morning and you don't get sufficient enough of sleep, you need to change that immediately. Sleep is of paramount importance in the treatment of headaches, all types. And so it's not just taking medication. It is tremendously a lifestyle issue. Now, you talked about triggers. May I expand on that?
Yes, absolutely.
Well, people think triggers are causes of headaches. That's not true. Triggers don't cause headaches. They trigger headaches. In other words, you're prone to have a migraine. And let me just tell you, look into your family history. Know your family history, because if your mother or father had migraines or bad headaches, the chances that you will have a headache is 75%. So look into your family history, find your diagnosis, and then change things in your life. Look at your diet, look at your exercise, look at your vices. And most migraineurs tend to be a little bit obsessive compulsive in their behavior. And they need to have a very regimental lifestyle, which means if you sleep in on a Sunday, how many times has people in the audience slept in on a Sunday and they get a bad headache? Or if they fly over to California and those time zone issues, so they have to be relatively regimental. Migraineurs have to be regimental. So you look at all those lifestyles, and afterwards, after you've done everything and you're still having headaches, then you turn to your primary care physician or a neurologist or a headache specialist. So we don't need to monopolize all the headache patients in Western New York and beyond.
They'd be lined up around
Think about
the
it.
building
If
several
you think about
times.
it, 18% of women have migraines. So,
Wow.
so that means there's, in my estimation, there's about 180,000 women in Western New York with migraines. We are the largest headache center in the United States, and we see 20,000 patients a year. So there's just no way we could take care of all the migraine patients.
Right.
But remember what I said. Half the people know they have migraines. So the 180,000 women in Western New York, only half of them even know they have migraines.
Wow. Wow.
So the numbers are out there. So I like to share the love with all my colleagues. So the primary care, your gynecologist should be able to take care of headaches. When they're in trouble, they know about us in Western New York.
Right.
So they'll send us the patient, and we'd be happy to see him. And one of the advantages of a headache center is that you have a multidisciplinary approach. You not only have physicians who specialize and are board certified in headache medicine, which we all are. You also have nurses, you have MAs, receptionists, nurse practitioners, and PAs who only specialize in headache.
Wow.
So we have this atmosphere here that we not only treat headaches, another important part of the equation is we do research.
Yes.
Patients love to get involved in studies, and I emphasize that a study is not using some experimental mumbo jumbo. It is FDA approved drugs or FDA evaluated drugs that will be approved soon, that we have to study on patients, and after we study them, we publish these articles, and then after that, we hope to get FDA approval. So we do a significant amount of research here at our institute in headache medicine.
Well, that's why I'm so excited that your organization, your practice, is now sponsoring this television show so that we can continue to bring people this information. And your website is filled with information. I spent like 3 days researching and looking and was amazed at all that I found. And I spent how long looking at all of the awards, diplomas, certifications.
I'm not even sure if they're real.
I don't know, but there's quite a few of them all around. So I'm just so happy that you're here and so grateful for all that you're doing. And I know we'll be back again to talk to you some more. And I think we're going to go talk to your pediatric doctor now,
Dr. McVige, she's wonderful.
Thank you so much.
I thank you.
So as we're understanding, adults get headaches and so do children. And we've got a couple of beautiful young ladies here. Dr. Jennifer McVige's children are here, who also, I understand that you get headaches sometimes.
Yeah, whenever I get a headache, it feels like my head's pounding and my stomach starts to feel really weird.
Oh, that's not very much fun, is it? No. And I heard you had an injury at gymnastics?
Yeah, and my head feels weird whenever I do handstands and my tummy starts hurting.
Wow, that's not fun to get a headache, huh? But you know how wonderful it is that your mom is the pediatric neurologist here, and you have quite an extensive background. Why don't you tell us a little bit about yourself prior to DENT and all that you've been doing, because you've been doing some great work in the community.
Oh, well, thank you. I'm a pediatric neurologist. I trained at the University of Buffalo. I specialize in headache and concussion, as well as neuroimaging. I was fellowship trained in all of that. So we started a concussion clinic here, but I also had the pediatric headache portion of our department, and we've really put a lot of effort into the concussion side as well, trying to get some group services for individuals who have suffered from concussion and treatment services. In the past, we've helped take care of the junior Sabres. We do a lot of speaking engagements for the Buffalo Bills as well as for the Sabres to help educate the community on the importance of concussion.
Wow, that's pretty amazing, pretty amazing. We're really lucky to have you right here in Buffalo, right at the DENT Center, thank goodness. And oddly enough, your children suffer, both of them from one a migraine and one from an accident. Tell us a little bit about that, and especially in the news, what we're hearing, all these different occurrences coming up with head injuries, and how important this is.
Well, for Lola, she's an avid gymnast. In fact, she's an excellent gymnast, and she does quite a few headstands, actually. And we figured she was doing a lot of headstands at one point in time. She had a lot of pain in the upper cervical area, and we realized that one of her cervical vertebral bodies was a little bit maladjusted, and so we got that straightened out, and her headaches are all gone now.
Really? They all disappeared now?
Mm-hmm.
Wow.
And
Awesome.
Sophia is triggered by certain foods, as are a lot of children that suffer from migraines. In children, migraines can be just as debilitating as they are in adults. And instead of sick days at work, kids have missed school days. And unfortunately, with the rigors of school, as they are now, they miss 1 or 2 days, and they're so far behind. And many times, concussion as well as headache are the silent illnesses, in that people don't really understand how you're suffering because you look okay on the outside. You don't have a broken bone or anything, but inside you're very sick, as Sophie said, nauseous, dizzy, you can't focus, you can't concentrate. Even if you're present, you're not
fully
able
right,
to participate.
Right.
In the car mostly, like when say go on a long car trip, it really hurts to like watch a lot of movies and stuff in the car.
So what are some of the things that parents could know as people are watching and we want to help all the kids out there? Like, what are some of the things that parents can watch out for, some of the things that they can learn? You know, how do they learn about the food triggers and the different triggers? What can we do to help so many kids who are suffering?
Well, I think the biggest thing is identifying it. So many people believe that someone has a sinus headache or it's just allergies. And honestly, kids don't even develop their frontal sinuses until their teenage years. So if someone says, I have a headache right here, be very mindful that that might not be sinus, that might actually be migraine. If someone has light sensitivity, sound sensitivity, nausea, all of those are signs that someone has a migrainous headache, and children get them just as readily as adults. In fact, under puberty, it's equal male and female, but as soon as you hit puberty, then it goes up, where it's double the amount in female as it is in males.
You're kidding.
Right. So
Oh, my goodness.
around the time of puberty for young ladies, we see this drastic rise, and that's a big thing to look out for. As far as triggers, many things in the community can be a trigger, such as smells, not getting enough sleep, not eating breakfast, which is a huge trigger I see in my teenagers, staying up too late, as well as food triggers such as nitrates, luncheon meat, pepperoni, salami, bacon, hot dogs. The organic stuff does not have that in that. Also MSG, the lining of soup cans, bouillon cubes, salad dressings, those can be triggers. Certain cheeses, chocolate, caffeine. So you think about a kid's birthday party. What do we have? Cheese and pepperoni pizza, chocolate cake, and then
Every trigger
Doritos, and so it's crazy.
And so what you're saying, once again, is what we're always talking about on this program, is that you have to be proactive. You can't just, as we were talking about with Dr. Mechtler. I'm memorizing all the doctors' names here, is that it's not just about coming to the doctor and taking a pill. It's about educating yourself and paying attention to find out what foods, like what happened right before an episode started, and maybe using process of elimination. But you know what I love the most about what you said is what we're talking about all the time. It's amazing to me how many parents allow their children to drink soda pop, diet sodas, caffeinated, and all those processed foods. It's unbelievable. And even if you can't, a lot of people will say, well, they can't afford the organic stuff. Well, you can at least, in the very least, shop on the outside of the grocery. That's the biggest trick. You want to really learn to eat well and to take care and manage some of these things. You go around the outskirts of the grocery store, because in the aisles, they're all the processed foods. So talk a little, I just got so excited, as you can tell, when you talk about that, because it's one of the things that we're always trying to educate the public with.
The other thing that I wanted to mention too is that over-medicating with over-the-counter medications is something to be mindful of as you're talking about going around the store. Ibuprofen, Tylenol, all of these things are fine products, but when overused more than 2 to 3 times a week, that's dangerous. If you're using those analgesics, especially in young children, more than 2 to 3 times a week, you need to see your primary doctor and or a headache specialist at that point in time. And that's the same for concussion. Oftentimes we see kids will have a concussion or head injury they'll come to us and they'll have taken for weeks at a time or even months over-the-counter medications, and that becomes a new problem. Wow. So that's something to watch out for. The other thing to be interested in is the neck. As with Lola, neck injuries, neck health, and shoulders, and the backpacks kids carry, and lightening our load, and not, I watch her go to school, and the backpack's bigger than her body sometimes, and I feel horrible. So we try to lighten the load and not carry as much, because that can affect headaches as well.
And what do you think about all these game things that children have, and their computers, and their laptops and all that? Because I was reading about how we're all hunched over and we're
Like this.
and this is really bad for the nerves in the neck, which leads to headache problems.
It's true. I call it the turtle pose, because we're all, when you go ahead, if you think of a tree, if the tree is tilted, there's going to be a lot of stress right at the tilt area, which is right up in here, and it's going to hurt. And so we're creating these little people that are going to grow up to be adults that are having these cricks in their neck and popping and cracking, and that's not good either. So that's something to be mindful of. The video games, my advice would be, in moderation, everything in moderation. Especially after concussion, you have to be mindful of not doing too much of that, because you can exacerbate the situation by doing too many video games, too much TV watching, too much texting.
Would that be for when they get headaches too, or just for concussion?
Both.
Migraines?
Both. Wow. As Sophie said, when she sits in the car, if she watches a movie in the back seat of the car, it makes her more nauseous. People who have migraines are inherently hypersensitive to things around them, sight, sound, taste, smell, but also motion, and that view of things going by their eyes, they get nauseous.
Wow.
And with a concussion, it's even worse.
Wow, that's pretty amazing. Great information, and I'm so glad that you girls came in to talk with us too, so the young people who are viewing can hear some of the things that you've gone through and how much help you've gotten, and some of the things that they could do to help prevent those headaches, huh?
Yeah.
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 Yeah. Lucky girls. Well, I hope that people reach out. I've mentioned the website is amazing. It's jam-packed, filled with lots of information. And how would someone know real quick as they're sitting there thinking, well, where should I start?
I think starting with your primary doctor first and foremost. We have wonderful pediatricians in the community, wonderful providers, nurse practitioners, PAs. Start with them first, and if they think that there's an issue, and if you feel like things have gotten to the point where I said the analgesics are more than 2 to 3 times a week, we're always here. 250-2000 is our phone number. You can just call and set up an appointment. We'd be happy to help you to find out if it is migraine or not. And even if you don't know, just understanding whether it is or not can be helpful.
Thank you. Thank you so much.
Thank you.
And thank you, girls, for coming and talking to me. Great information we got today. I hope you took all your notes. I hope you visit the website, and most importantly, you have the education and information to help yourself and your children. So share the information. Email me and let me know if you'd like to be on the program as well. And email me with your comments and your questions, because I love hearing from you. So always remember, your health matters. You only get one body. We could start over at any time, but one body. Let's take care of it and make some good, healthy living choices. Stay tuned to hear from a few more of our amazing, wonderful sponsors.
Hi, I'm Kim.
I'm Mitch from Pure Life Energy Saunas.
And together we are proud sponsors of Health Matters, a program that educates the community on how to be healthy, mind, body, and spirit. So follow us, because your health matters.
Hi, I'm Kimberly Will from Mr. Frank's, and I'm a proud sponsor of Health Matters, and I am very motivated and inspired by all of the information that the show offers.
We want to thank Marge Reed from the Healing Spa. Marge is an ordained Unity minister. She has her BA in complementary health, and she's joined by her beautiful daughter Gina, who's a registered nurse. Together they bring us the latest technology in stemology, skin care, stem cell therapy, and holistic modalities for your body, mind, and spirit. Join Marge on Sunday mornings for her 11 a.m. service.